So
Okay.
the V shot and using PRP treatment. So tell us a little bit about what is the V shot? What is PRP? How are you using this in your practice to help, women, with various issues that we're talking about?
Yes, absolutely. Well, PRP, what it is, it's a regenerative type of using your own blood for something that it can achieve in your body, an effect that can make things better, heal, and enhance your body. But what you're doing is you're taking a sample of your blood and then you spin it in a machine and you extract platelet-rich plasma, which is the PRP, and it's full of natural growth factors. And then you inject it gently into the vaginal area and into the clitoral area. And those growth factors signal to your body, grow new tissue, heal the tissue, boost blood flow, increase collagen, regrow nerve endings. So it can restore like natural moisture and sensitivity and even strengthen the area. I have amazing results with PRP for patients that have they're starting to have a little bit of stress incontinence. Stress incontinence means when you cough or laugh or jump, you lose or lose a little bit of urine, or you leak a little bit of urine, you soil your underwear. That's already starting stages of weakening of your pelvic floor and the bladder. And by injecting that into the bladder neck, I can strengthen the tissue there. I can bring more support there and increase collagen, and also by injecting into the clitoris, I can help the woman have more sensation there.
Yeah, so that's super convenient, I'm sure,
Yes.
for most. So let's talk about you mentioned incontinence. So let's talk about like who is a great candidate for the V shot and what issues have you seen, besides obviously the incontinence that really has made an impactful difference, in
Yes.
sexual health.
I would say the most impactful changes I've seen. So usually anybody with vaginal dryness or atrophy of their tissue down there, especially if that's been going for many years. And if they're on vaginal estrogen, but they still want extra help, or they cannot use vaginal estrogen because for some reasons they don't want any hormonal creams down there. Like often cancer patients have fear of vaginal estrogen, even though, to be honest, we have new data that says it can be safe for cancer patients too. But there are women who don't want to use hormones.
Right.
And so they could be a great candidate. Anybody who, despite using the vaginal hormones or the DHEA estrogen, still wants additional help. I have those patients as well. They
Mhm.
sometimes need more treatment and they have pain with intercourse, or they have scar tissue there, or they have dryness. Those would be great candidates. If you have loss of sensitivity, the vaginal estrogen might not help bring that back as much. And so the PRP can be a great one for that, the loss of sensitivity. Or if you have leakage of urine when you laugh, sneeze, or jump, granted, if it's already very progressed, very strong, like you pee yourself every time and you get up, or you have absolutely no control, you have a bladder, I cannot achieve that much change. But in the early stages, we have amazing results with that. And so the results I've seen is, more moisture, better orgasms for women, less pain with intercourse and intimacy, and better bladder control. Now, one of the most amazing results also outside of that I have seen is for my lichen sclerosis patients. Those are women
Yeah,
who have a skin condition
yeah.
where their skin on the at the entrance of their vagina, on the inside of the labia and at the introitus, completely, thins out, dries out, becomes super itchy, and they have to use steroid cream. It's a special condition. It's autoimmune, inflammatory. And
Yes.
with the PRP, I have the most amazing results where
Ah,
patients have a lot less pain, a lot less itching, the skin rejuvenates. That is probably one of my most favorite applications. And
wow.
so lichen sclerosis, it's so important for clients to know, if you're just using a steroid cream and nobody has told you there is more out there, you need to know how helpful PRP can be for you.
And together, when you collaborate, it really can make a big difference for
Yeah.
patients. So that's great. So
I
you
love that.
talked about using the PRP and the V shot for stress incontinence.
Mhm.
Tell me a little bit more about, is it more you're injecting into the pelvic floor area? You mentioned around the neck of the bladder. Talk to us a little
Yes.
bit about the specifics of what's involved with that.
Absolutely. And there is more and more things coming out. For example, often people combine it with lasers or
Hmm.
threads that can also boost the tissue. But the real idea behind it is when you have bladder leakage, you have the bottom of your bladder, the neck, weakens a little bit, that tissue. And it's the tissue between the vagina and the bladder. It's thin and it has, connective tissue and small muscle fibers. And childbirth or pregnancy or just with age, that tissue weakens. And when we inject the PRP in there, we restore and boost collagen and blood flow. And that can allow the area to become firmer and more responsive and boost collagen and tissue buildup there. As and especially in the earlier stages of that change, it can have amazing results where we can prevent the patient from having to get surgery. When it's
Right.
very, very progressed and the bladder is almost falling
Prolapse.
out or there's a lot of weakness, there's a prolapse, you do need more invasive surgery for that.
So I know that you mentioned PRP is a good option for vaginal atrophy.
Mhm,
How does this differ from traditional care? Like if
mhm.
somebody were to go in and they were experiencing that, what would a traditional doctor do versus, what you would offer?
I think the super traditional doctors, unfortunately, say that might not even do anything. And then
Mm,
the ones who are a little bit more informed will think about estrogen, right? Or vaginal DHEA, so hormones, right? But then often if the patient doesn't have all the results they want, they might be at a loss, right? There are companies that go and visit the physician groups and have like products like hyaluronic acid suppositories that one can
mm,
insert for atrophy. So these are the traditional things: hyaluronic acid and hormone creams or
mhm,
suppositories. Some OBGYNs do offer also lasers, like a Mona Lisa laser, which is a
mm,
CO2 laser that has a probe that can be inserted into the vagina, and it applies heat, and that
mm.
heat creates minor, it sounds a little bit brutal, but it's not, but it creates minor injury, like minor burns, and then
Right.
allows the tissue to regenerate
To
itself,
repair.
right? There
Yep.
is also other type of vaginal devices like radio frequency devices that can be inserted, that heat would create more blood flow and healing. And then
Mm,
there is the PRP, which repairs the tissue, can rebuild the thickness and the elasticity for those tissues. And I think it can be done in adjunct to all of those things. And it can be an additional help for those who don't get enough relief. And as I said, it does have a few other additional helps with like the clitoral sensation or
right.
the leakage of the urine, which maybe those lasers or the vaginal hormones don't always help with as much, even though they all have their effects. So yeah, but the very traditional doctor, I'm not sure they do a lot
Yeah.
beyond maybe saying use a lubricant or hyaluronic acid, or at
Mm,
most, hopefully, they do recommend the vaginal estrogen. I don't think suffering is normal, and suffering in silence doesn't need to happen. And so dryness and pain and loss of sensation and, embarrassment when you're leaking urine, it's not just aging, right? You don't have to deal with it. You
mhm.
actually deserve comfort and confidence and pleasure at every stage of your life. As long as you're alive, you deserve those things and you deserve to feel good. And it is normal that there are changes down there, but it's not normal to suffer from them.
Yeah.
So if you're curious, if you want to know what's out there, you do have doctors like me who do offer these services and give you some options and can offer you support.